Boris Johnson will today tell his cabinet he intends to continue with Plan B and not introduce further restrictions in England.
But reports today that some heart attack and stroke victims calling 999 in the northeast may be told to make their own way to hospital, as that region experiences a huge growth in COVID cases. Well, joining us now is the Minister, Gillian Keegan. This is your department. Gillian Keegan, good to see you this morning.
Morning.
It makes me panic, the idea that if I was in an area where I was calling 999 because of an emergency, I was told that I wasn't going to receive an ambulance visit within 18 minutes, which is the target in this particular area. It could be 2 hours. And did I have a way to get myself to the hospital? Did I have a friend who could drive, or could I call a taxi? I mean, these are people who need emergency critical care. That's a disaster, isn't it?
Yeah, and whilst we know that the ambulance service is under a huge amount of pressure, as is the whole of the NHS, that actually is unacceptable. So what we have done, actually, we have built up, we have more ambulance crews in operation than we've ever had before. So over the last 2 years, we've built up our ambulance service. We've also given an extra £55 million just for this period to ensure that they've got some extra staff, etc. And I understand that, of course, there's some difficulties in the processing and you know, there's been some difficulty with the ambulance service. But if you are in an emergency, you should be able to rely on your ambulance service. So I've actually asked NHS England to talk and kind of figure out what's going on at that trust, because that doesn't sound like that's the right service. That's not the service we expect.
So you have ordered an urgent investigation into what is happening at North East Ambulance. What other ambulance trusts and people in other ambulance trusts? I mean, firstly, as you say, it's unacceptable for people in that area. But you want to stop this happening anywhere else. I mean, the fact of the matter is that we shouldn't be in a situation, should we, where we are lacking that many ambulance crews. But we are, because this new variant is so infectious.
Well, actually, the pressure on the ambulance service, and actually it's the whole of the NHS, requires the whole thing to work together. We've been working on this all over the Christmas break to look at where those pinch points are and to try and make sure that you have smoother passage as you get the ambulance through into A&E, and also discharges as well, to make sure that that's working well. And there's always those pressure points that you know, every trust will tell you that they live with that all the time, and they're always working on making sure they work as smooth as possible. Obviously, when you have a high number of cases like we have, and a high number of hospitalisations and an increase, that does put further pressure on the system, which is why we've been working to try and help that pressure in the system. After saying all of that, though, it isn't right that if somebody has an urgent need, like a heart attack, that they should be told that there is not an ambulance for them. That is a high priority in the NHS system and in the ambulance service system.
Anybody calling 999 for an ambulance, whether it's a heart attack or anything else, is in urgent need. I mean, what this shows is that you say there's a sticking plaster of money, but we've had years where the NHS has been underfunded, and that's what's got us to this point. We are unprepared for a situation that we're in right now.
Well, to be fair, I mean, I don't think anybody would normally prepare for this type of variant with the absolute rise in hospitalisations. But what we've done over the last few years is we have built up more doctors, more nurses, more ambulance staff. We have invested a lot, £34 billion a year extra in the NHS.
We are 20,000 nurses short. We're 6,000 GPs short. And you've just told anybody who's not vaccinated they need to get out of the care sector and the NHS.
There were also predictions that another variant would come along that would be more transmissible but more mild.
Yes, but let me take those two things in order then. So first of all, there's a growing need all the time in terms of our NHS service. So when you say 20,000 short, we have always trying to run to catch up, but we have put 20,000 more, well, 10,000 more nurses have started in the last year or so, and 5,000 more doctors. So, of course, you can only do what you can do, and obviously the recruitment and the training takes a long time as well. We've set up nursing schools, we've set up medical schools. That takes time as well. But we have invested, and we have invested in the pipeline of talent coming from and actually growing our own talent as well as international nurses as well. And of course, we anticipate as much as we can, you know, what the pressures that the health service are going to be under. The contingency plans that we put in place are why we think we can manage this wave as long as everybody comes forward and gets boosted. But it isn't easy. It isn't easy to deal with situations where you have a lot of staff going absent, a lot of new cases all happening at the same time, as well as having a 2-year backlog of a lot of other surgeries or other conditions that people would have come forward in those 2 years during the pandemic. The pandemic has added a lot of extra pressure on our health service.
Brexit has seen an exodus of staff go back to EU countries.
That is true. And also, in terms of this pressure, and in terms of staff absences, coupled with people disappearing from the country partly because of Brexit, so far 6 hospital trusts have declared a critical incident. Collectively, they represent something like 20 hospitals. That means that all sorts of treatments, from cancer to heart disease and many others, are under threat. People may not get treated for those because there's a critical incident. How bad does this have to get? How many more trusts have to declare a critical incident before this government will consider more restrictions?
So 2 things there. First of all, you made a comment about Brexit. Just to remind everybody, 6 million European people settled here after Brexit. Many of them are doctors and nurses, many of them working in our health service, and we thank them all very much for their service. Secondly, cancer and emergency treatments, that is not what is being discussed in the critical situation. So these are local decisions that are made, and they're part of the contingency planning that we have in place. They're the first step of the plan to basically say, we need more support, we need more help. What happens after you declare a critical emergency is you then work with your NHS regional team and your local resilience forums to see what additional support that you need. There is no way that we will be saying, heart attacks or cancer treatment. Those critical things will be continuing. And I know, having spoke to many of trusts, that they are continuing doing that. Many of them are actually continuing with elective surgery, although some of those less urgent things could be temporarily slowed down or stopped if they needed to in an emergency situation. That's part of what the local trust needs to manage and will manage all the time. But the critical incidences is a part of the contingency planning, and it's the first stage, and there are many other stages that we can go through.
If it gets worse and worse, what happens? What do you do?
So we have a whole range. These plans are very tried and tested, by the way. They're put in place and they're there every year, and we've put more resilience in them this year. So there's a number of things. Obviously, mutual aid from surrounding areas, volunteers, retired staff coming back. We also have other local councils and local staff that can also be moved to more critical areas. And then, if required, and I think the Prime Minister mentioned this yesterday, if required, trusts can then work with the military if we require military presence as well. There's a number of those phases, and none of those actually we're utilising at this point yet. But we may be starting with some of these trusts to be talking about some mutual aid, for example. Because the word critical is used, it is the first part. It's a local decision. It's there. It's deliberately part of the planning process. It's part of the escalation process, and they're using it because they need to move to the next stage of escalation.
You just mentioned that 6 million people settled here after Brexit. 6 million, of course, does cover some NHS and care staff, but it's a distracting figure. How many NHS staff left because of Brexit?
Yep.
Well, I don't have that number, but what I know is when we were first discussing Brexit...
How do you not have that?
When we were first discussing Brexit,
do you not know?
What I know is there was a number that was discussed, which was 3 million, and there was very much a campaign about, the 3 million, making sure their rights were protected. And actually, we then opened up the settled status. And the settled status, which, covers people who can settle here, there were 6 million people on that.
Are we net up or down?
6 million, not 6 million NHS workers.
No, 6 million people.
Yes, I know. We're Gillian Keegan, I'm deliberately...
We have 1.3 million people working in the NHS, so not all of them would work in the NHS.
Of course.
We have 1.3 million people.
I'm asking you, as a minister in the health department,
Yeah.
how many NHS staff left as a result of Brexit?
Very good question.
Well, I don't have that number, and actually, I don't
I'm
think
asking you why not.
Are we
Well,
net
we
up or
don't- we
down?
don't
Are we
measure
up or
the-
down? NHS
We
workers.
don't measure our NHS staff and by where they come from.
Do we have more or less because of Brexit? Do we have more or less NHS staff because of Brexit?
We have more NHS staff in general, and they've come from all over. Actually, the last ones that came to my own hospital were from the Philippines. They come from all over, and there's also lots more medical schools and nursing schools been set up here to help our own young people or people who want to retrain or in their second career can retrain to be a nurse or a doctor. We have more nursing schools and more medical schools for people to train in as well as having open visas for people to come from many parts of the world, including from Europe.
So, according to figures, and this is 2 years ago, more than 22,000 EU nationals have left the NHS since the Brexit referendum. That was 2 years ago, so I have no idea what the figures are now. But you are saying every single one of those posts has been filled by somebody else?
Well, what we have is, in general, net figures, 10,000 more nurses and 5,000 more doctors. So they've more than been filled. They've been backfilled as well.
Okay.
So, but we have people move around all the time. There's 1.3 million people work in the NHS.
But we started with a shortage. We started with a shortage of 20,000 nurses.
Yeah.
And you're saying that you filled that number with 10,000 nurses.
Yes, so we're still, that's a goal that we have to recruit 20,000 more nurses. We've recruited 10,000 of them have already started, but we're still recruiting all the time.
All right.
That's clear. Gillian Keegan, thanks very much indeed.